Okay, so I'm just trying to get my lights sorted in here. It's gonna be dark for a second. Okay, so it's currently what time? What is it? It's like 8 something? 8:30. I've worked her out, which my workout was literally crap, and it is what it is. Yeah, my workout was literally crap. I woke up with a headache. I still have a headache. It's like, what can you do? Colby. So that's kind of where we're at. I'm gonna have some coffee, see if that helps wake me up a little bit, and then make breakfast and do makeup and stuff. But it's 8:30, so I got some time. But hi, Colbs. Colby. Colby. This is what I deal with every day. And I'm also really tired, and I don't feel very good. But did you eat? Did Grandpa feed you? I guess you have to go in and see. Ooh, my pants are too big. I'm wearing this shirt that like doesn't really work with these pants, but you know what? Who cares? I'm on Zoom all day. It doesn't really matter, does it? Okay, so hello, good morning. It's currently Wednesday. It's like 6:30, I think, something like that. 6:45. Haven't done makeup. I need to get down on that. But today is very important. I have a doctor's appointment that I actually have to go into later today at 10:40, something like 10:15, which means I have to leave halfway through my class. Woo! And I'm looking forward to just seeing her and getting that out of the way and seeing what she has to say. The ideal situation is that she tells me, okay, let me send you over to the surgeon. I don't think that's gonna happen, but that's okay. I'll show you the outfit I'm wearing because I always tend to do that. It's this 2-piece from Hollister. It kind of hides that, like, well, you can kind of see it right there, but it's very big. As you can see, you can even see, like, it was not that big a few weeks ago, but that's okay. We're gonna do okay. Like, my crotch is not where it needs to be, but it's fine. The top is a little big, but it's not terrible. Like the one I was wearing yesterday, it's kind of like a similar cut, and this part was like all the way over here because it's just too big. But that's okay. I'm gonna have some coffee right now. I'm not really that hungry because I had a pretty big dinner last night. We had pizza, so that was pizza that we made and all of that. So I just am not really that hungry at the moment. So I'm probably gonna just have coffee and see where that goes in the next hour. And I need to do my makeup, and so that's what I'm gonna do, and then we'll see what happens. I don't know. That's my life. Okay, so my makeup is done. I look very flat today, but that's okay. I still am not hungry, so I probably will have to eat after I get done listening to speeches for my students, and then between that and my class that I take. But that's okay. We'll see, even if I'm hungry. Sometimes if I eat a big meal at night, I'm not super hungry in the morning, even if I work out. So we'll just have to see. I have tried my best to be as an intuitive eater as I can be, because that works for me. It hasn't always, and I would definitely say if you've struggled with an eating disorder, you know that it's a little bit harder to be an intuitive eater when you struggle with that. But over the years, and kind of, maybe I'll talk about that journey on my main channel at one point, but over the years, I've kind of gotten to a point where, like, I'm good. Like, I don't really struggle. So, I mean, I have days, but I think we all have days where, like, we don't like our body. But for the most part, I'm okay. So I find it easier to be an intuitive eater, but also keep in mind, like, it's taken me years to get there. And also, I don't know, I just find that to be kind of where I'm at in my life. If I'm not hungry, I don't eat. But, like, I can't do intermittent fasting. Like, like, I normally don't, well, sometimes I eat this late, but not always. So, yeah, I'm just pointing it out there. Okay, so I have a doctor's appointment. I just got done with class. And I'm having some issues with that, as it just flew off. I don't know where it just went. I have this like little thing that goes over the camera and it like is being annoying, but oh well. Okay, I gotta grab my gloves and mask, and then I gotta get out of here because it's 10:18. My appointment starts at 10:40. All right. Okay, so got back from my doctor's appointment. So the frustrating part is that yes, I will have to have another surgery. It's exactly what I thought it was, which is a lipoma. I thought it was small, okay, because in my brain, comparative to the last one I had, which if you go back and look at those vlogs, I don't think I ever showed it to you, but I'll probably show more of the process this time around. But yeah, so basically it's the size of like a small baby head, basically, and that is going to be very complicated. It's on my leg, and there's a lot of things that have to go into this. Well, they sent me to the, I did get the referral authorized, so it's all good. I'm just waiting for them to open back up, which they open in like 20-ish minutes, so I can make an appointment. But the surgeon that I saw last year and did my last 2 surgeries is no longer with this practice. And the problem is with that is that, which I actually don't, okay, it's not about gender. I want to put this out there. I prefer female doctors because that is what I'm more comfortable with. However, I do see male doctors. It's not that big of an issue. Surgeon-wise, I have had male surgeons. My first surgery ever was my gallbladder removal. I believe that was in 2016, and that was a male. Like, he was fine. That surgery was not complicated. That surgery was super easy. No big deal. Well, obviously, the last one, it was underneath my breast, so I wanted to have a female surgeon. This time it's now in my inner leg, close to my groin. I don't really care. Like, I don't really care. As long as it gets removed as quickly as possible. However, like, I think I mentioned this. Like I said, she would like me to ideally lose 20 pounds from now, which is fine. But she's like, I don't know how long it's going to take because, first of all, she just sent me the referral. I have to wait to see if they'll need imaging, which I don't know if they will. She's like, I don't suppose they will. I think the only thing they might need to see is if it's encapsulated. But to be honest, she's like, it doesn't even matter because the last one wasn't, and they just removed it anyway. So that's kind of what we're at. I think I want to show a little more of this process this time around because I looked at those old vlogs and I didn't have the same process. I didn't show it, and so I'm going to show it a little more. But if you're curious, if you didn't watch the last vlog, I believe is where I showed it to you, this is what I'm working with. So just be mindful. It's right there. So do you see how it like bulges? So this side doesn't do that, and like see how it's kind of like thinning out there? See how it's super big? That's where we're at. So, like I said, I didn't actually show you the one that I had last year, but whatever. It's really frustrating. It's really, really frustrating. Even though I was kind of mentally prepared for it because I knew that that's what it was. Like, I knew I was gonna have to have surgery. I kind of mentally prepared for it. It still was a hard pill to swallow today because I had surgery. So this coming Friday, so the day that I'm posting this, would be a year from my surgery. The first one I had last year. Obviously I had 2 last year, so this will be going on to 3 in a year, basically. A little over a year. So it's just a lot, and it's not something I expected. I mean, obviously I knew in the back of my mind that I was going to have surgery, but it still scared me. I don't know, it still is like, kind of freaks me out, especially considering I'm gonna have to lose ideally 20 pounds, but I'd like to be at least 10 pounds lighter before I have surgery, and hopefully, I mean, because right now, because of COVID and things like that, it kind of puts a little bit of a pause button on things, but I need to get things started with appointments, and if they want to do imaging, which she's like, I don't know if they will, considering like you had a lymphoma last year that you had removed with the same group and the same practice. I don't know if they will, but I'm going to go ahead and send you over there so that they can make a decision on what they want to do. So that's kind of where we're at. It's frustrating because I don't really want to have to go through surgery again, especially in my leg, but she's hopeful that it's going to be less complicated. Obviously, being at a lower BMI, which I definitely am from last year, there is a little bit of a positive in that it makes things less complicated. However, with the size of it, there's complications. So last year, if you didn't watch my vlogs, go back and watch them, but basically I had a lipoma removed. Well, they didn't really know what it was initially. They thought it was breast tissue, ended up being a lipoma. And because it was like, so I don't know if I can, it's like, it was like, my incision is from here to here. My incision is pretty long, and because there was so much, like it was a huge mass. It was a huge lipoma. So they didn't put a drain in initially. The surgeon, she didn't think it would be a problem. I mean, obviously being overweight is a little bit of an issue, but she thought like, oh, like, sorry, my battery died. So she thought it would just be okay and it wouldn't be that big of a deal, and didn't turn out that way. I had problems probably about a week and a half in, so before my post-op appointment, and I immediately developed a seroma. So basically what that just means is that it's like a hard encapsulated space in between your skin and then where they removed like your muscle, like it hasn't closed together. So like, you know, if you're pregnant, you have, sometimes people have like the ab separation, doesn't grow back. It's kind of the same idea, but your skin, between your skin and muscle. And again, it wasn't like, so they put a drain in, they drained it, hoping that the seroma would be removed. Obviously, I think I'll post it probably in the cards, but I went to the hospital. I don't know if it was that vlog or the next vlog, but I went to the hospital and the drain had fallen out. Like the piece that was inside my skin fell out, and they couldn't put it back in because there was nothing left to drain. So it was just a hard encapsulated space that had nothing in it. So they had to go back in at 3 months after my initial surgery to remove the seroma. They didn't remove it all, so I might have to go back and have that removed, but I don't, like, to be honest, it's just for like vanity and like what you look like, and I really don't care about that at this point. So essentially they went back in and they left the drain in the second time around. So she said that them knowing this, because I'm going to the same practice, even though it's not the same doctor, because at the time when I got to the appointment, like I thought she was working back in that practice, but she's not working at any practice. Otherwise I'd have them switch my referral, but it's okay. It is what it is. It's fine. Like, I'm gonna just be like, it's gonna just be what it is. So basically she said that by them knowing this, they could just initially put a drain in, which being where it is at and located, I'm not thrilled. But obviously I thought it was a lot smaller than the other one, which it is, but she's like, it's actually pretty massive. Like, you want them to be only like a few centimeters in length, or like a little mass, but mine's over 10 centimeters, which is obviously bigger than a small baby head. So, or like at that size. So essentially it does cause complications. So initially they probably will put a drain in. And the frustrating part is, like, with COVID and things like that, the surgical center and like surgeries, elective surgeries, which this isn't really elective, like I'm gonna have to have it done, just because of where it's located, it might take a month or so to have surgery. So it's complicated and there's a lot of factors. I'll take you through the journey, but it's just, and I'll kind of weave them in here, but it's a hard pill to swallow for sure, because I just was not, I mean, yes, I was expecting it, but I also was kind of hoping and praying that it was not going to happen, because now I'm going to have another surgery, and I actually don't mind the incisions. Like, it just is what it is. Like, they're battle scars, but it just like sucks that I'm going to spend another summer dealing with surgery and like all that. But ideally this would go smoothly and I won't have as many complications. I don't know. I can have hope. It is what it is. I can't, at this point, like, as long as I have an appointment and as long as I get it taken care of, I actually don't really care. Like, I just don't. I don't care. So, I don't know. I don't know what else I'm going to vlog. I just need to process that. That's a lot of information. That was a lot of like, not, I mean, it's expected, but not expected, if you know what I mean. So, I'll see you next time. Okay, so it is currently 8:30 at night. I kind of wrote a little bit of my paper, not very far, not even halfway done, so it is what it is. But I did get an appointment for tomorrow for the surgeon, so that's where we're at. So I see him tomorrow with obviously my original surgeon is no longer with them, so I have to see a different surgeon, which I'm okay with. I just hope that it doesn't, yeah. Hopefully it's an easy surgery and we don't have to worry about it again. I don't know. It's just is what it is. I also have like a bruise on my leg. I don't know if you can see it. I was picking up on camera, but I have a bruise on my leg. Also have to use this like cream stuff because in that particular area where the lipoma is, my skin is like notorious for giving me ingrown hairs. I have them on my arms. I have them other places, like, so whatever. So on my legs, I do get them occasionally, but the doctor today was like, I would much rather give you this cream that's supposed to reduce some of the, I don't know. It's to reduce some of that and to do that because if I'm gonna have surgery there and all that, she is a little bit worried about infection and things like that. So yeah, and also the surgeon tomorrow, I'm not allowed to go with anybody because of COVID and everything, which I know they're just taking precautions, but it definitely sucks because I have to go to this consultation on my own and deal with it. And then tomorrow's gonna be so busy. I have that for an hour to come back really quickly, do the class that I teach. Then after that, I have a few hours we'll be able to eat and stuff, and then I have to hop on a meeting for half an hour with someone from my department, and then I have a student thing that I have to deal with on Zoom. So it's just like tomorrow's gonna be busy and I am exhausted already. So the only thing is I'm annoyed by is that I don't know, it's just like I still have to lose more weight. I mean, they'll still do the surgery. It's more like my doctor would like me to be 20 pounds lighter before I have surgery because that'd put me at like a better BMI, but I think it's like technically 15 pounds if we're going to be really real here. It's like 15, 20. So it is possible that it could be done, but it probably is not going to be because I've been losing like 5 pounds a month-ish. So like I'm probably not going to get there. So like we're just going to have to accept that it's not going to happen before I have surgery. Also Friday, we're supposedly supposed to know what we're doing in the fall, whether that's online instruction or not. So that kind of, I also want to know before I set up a surgery date because I kind of need to know that. But yeah, that's kind of what's going on. There's nothing really. I'm gonna watch some TV for half an hour and then I'm gonna go to bed. Okay, I'm actually leaving. I have to go to my surgeon's appointment and we will see how this goes. I'm kind of debating not bringing my water because then I don't have the other one since I used it yesterday. Shit, okay. And I don't, okay. Oh well, I'm not gonna bring that. Okay. Let's see how this goes. I always have water with me, but due to the situation, I'm not going to. All right. So I'm going to go to the surgeon appointment. We'll see what they say. I don't know what the plan is here. They might decide they want to do. I don't know. So I'll give you a heads up when I get back. It might be a little bit stressful because I have to start class and all that, but I will see you. Okay, so I have like 7 minutes before I need to be on Zoom. But I did go meet with the surgeon. So all of that is all good. I mean, again, not the surgeon that I'm used to or the surgeon that I've had before. That made me slightly nervous, but you know what? It's all good. He seemed he knew what he was doing. We're all good. He's been doing surgery for so long that I trust him to do what he needs to do. So that's kind of where we're at. Let's see what else. My dog is playing with me. Sorry, she missed me. I love that you miss me, but you are scratching mama. Yes, you're scratching mama. So, oh my gosh, this dog is pissing me off today. Stop. She's trying to get up here. Okay. All right. Okay. So basically, because of COVID and everything, they're not booking as fast. Like, a lot of surgical centers are booked out, and I have to go to a surgical center because the hospitals aren't doing surgeries around here. So, at least elective surgeries. So, I am. Sorry, I'm getting like pelted by this dog right now. Sit down and chill. So, by the end of May, I should be having surgery. I'm not gonna share the date of surgery just because obviously it can change. But also, you know, I just want to keep that private. I'm gonna share a lot more of that journey on here, the prep and the everything, because I didn't share that last time and I really regret it. So, we're gonna share more of that this time. Tomorrow, which is Friday, which is the day you're watching this, will be a year from my first surgery last year. So it is a little bit crazy to be walking into that office again. And it's not something I really would love to go back to. But can you sit, please? What are you doing? But it is what it is, and there's not much I can do. Okay. All right, baby. She's like literally standing on me. You're gonna fall. Yeah, you're gonna fall. Oh, he's like getting on my last nerve today. So that's kind of the plan. I can't believe this is happening again. Like I just, how do I say this? You know, obviously last year was rough. I had a really, really rough year last year. And obviously I went through a CFS crash, and then I went through 2 surgeries, and I'd be lying if I didn't say it scared me to go through the surgery, because obviously the last one was so complicated and I had to have a second one. But I also know that if I don't get it done now, it's going to be worse, and that's what caused the surgery I had last year, a year from the day you're watching this, to be so complicated. So, you know, obviously it's not ideal. I don't want to be having surgery again. This is not something that I was planning on doing after I've been doing really well and working out and being active and losing weight and things like that. I've done all these things, and yet I feel like we're kind of back in the same place we were in last year. Obviously feeling a lot better and doing a lot better, but it does scare me. Like, I'm hoping that the surgery itself isn't too complicated and that everything goes well and is good and all of that. So I will keep you updated on here. Who knows, I might just do like a whole video on my main channel, but you know, that's where we're at. I was not expecting, I mean, yes, I prepared for it mentally, I think, but I was not expecting it to really be that quickly. They don't even need like any like imaging. They're just gonna do it. So that's where we're at. I'm just waiting for the authorization, and then we can call it a day. I'm gonna go ahead and get class kind of started. Alright, I'm gonna go ahead and end the video so I can edit in between this and my meeting, and then you can get a video tomorrow and while I work on my paper. So, peace.
Anyway.